Primary words, acupuncture. Secondary words. Page title, Acupuncture with Stimulator. Subtitle, Alternative Cure for Stroke Survivors. Stroke survivors now turn to traditional Chinese cures combined with modern technology to speed up recovery and reclaim their lives. Chinese medical theory cites that excesses or deficiencies in food intake, work, exercise, emotions, and so on, can cause illness. More people are discovering just how effective modern alternative health and therapeutic treatment is in healing ailment ranging from tension and fatigue to pain and serious illness like strokes. Majority of stroke patients are left with some forms of permanent disability that interferes with normal daily activities, such as walking, speech, vision, understanding, reasoning and memory. To ease the condition there is various treatments and rehabilitation involves using a mirror. It is believed that if a person who has had a stroke watches how the unaffected side of his or her body moves, it can give visual clues to help the person move the affected side. Traditional Chinese medicine, which is acupuncture, employs the additional use of a machine to stimulate the needles and, in effect, provide relief where needed. Acupuncture is one Chinese treatment, which has been intensively researched on, challenged and corroborated by Western doctors. The Journal of American Association of Anatomists indicated that acupuncture points correspond to areas where connective tissues are thickest and which contains many nerve endings. Far from being a fleeting trend, acupuncture has become an accepted healthcare practice. It involves science intersecting with nature. Electrotherapy is among the services, which offers holistic and integrated approach based on the intrinsic flow and energy balance theory of health and healing. It has proven to be a very effective treatment, especially when administered within 1 year after a person suffers a stroke. It is able to help improve blood circulation, speech, and motor facilities. A stroke is a brain damage caused by lack of blood flow to a portion of the brain. It results in permanent damage to the brain tissue and in many cases permanent disability for the patient. In addition to physical consequences like speech disability and paralysis, stroke survivors often deal with the psychological effects, like feeling depressed, angry and frustrated at their inability to perform tasks that, before the stroke, were easy or automatic. The person's general ability to take part in a rehabilitation program after the stroke is important consideration when decisions are being made about rehabilitation. Rehabilitation begins as soon as possible after a person is admitted to the hospital.